Hello everyone, how are you all doing today? We are here at South Florida Integrative Health Center, and it's the end of a Monday where we are video consulting with many people out there, really trying to figure out what is the underlying cause of why they are having symptoms, not feeling their best, or when they were remembered, when they were once feeling vital and energetic. So how is everyone doing? So today we want to talk about what we can look forward to in integrative medicine and holistic medicine for 2021. You know, it's been really a challenge. What can we say? It's hard to even put it in words what kind of year this has been. But when it comes to health, we've come together as a consciousness where we are all realizing we have to put together mind, body, and spirit, or that could be considered energy, and frequency and light seems to be coming into even integrative medicine. And what I mean is, we've always discussed in holistic and alternative complementary medicine the idea of energy, and we've used words such as in the Eastern philosophies as chakras and meridians and chi, and that actually can be measured in many ways. Even auras within the last few decades have been able to be measured. So we're actually looking deeper when we say energy, and we're getting more and more into that. And of course, we have the downside of negative types of frequencies, and we're studying more about EMFs and how that affects sleep, and of course other degenerative diseases, these negative frequencies, such as dirty electricity. We have meters that measure certain amounts of electricity coming from our wall outlets, and even lately I've been unplugging some of my lamps or other appliances that are closer to where I'm sleeping. That's where you spend 8 hours or approximately that much. So there's light, frequency, putting it all together, mind, body, and energy. And so in the future, what we're looking forward to, 2021, actually we've been working on it and really optimizing it as far as an integrative center. I've been involved very much. All of my commitment and my mission is to really understand and help clinically. That's why I've always been in the clinical setting, as well as really digging deeper into the research. And that's that combination of research and bringing it into practice. So that's why we measure these markers of inflammation and autoimmunity and endothelial dysfunction, which just means how these our arteries are inflamed and undergoing reactive oxygen species or oxidation. So what we want to do, and we're learning, and we're all seeing how food can be medicine, how we can get vitamin A, vitamin D from food, even though we know it's really good to take because of our immune system, and we're taking some of these things like zinc and supplements. How is everyone doing out there? Thank you for joining. So today I wanted to speak about all these exciting things that you're going to see in integrative medicine in the future. One of them is the mitochondria. We've been really digging deeper into that mitochondria. Once we've kind of enlightened us in a couple of decades already now, when we saw people getting these really incredible athletes getting kind of what's called mitochondria fatigue or myopathy, basically that ATP, what we understand so much more now with NADH and coenzyme Q10, PQQ, acetyl L-carnitine. We understand much more about it, but we really were enlightened about the mitochondria not too long ago as far as medicine is concerned. And that is going to be one of the main focuses, going into the next year, which we can't wait. 2021, the year of the mitochondria, where we're going to really get into that ATP energy and the phospholipids and the mitochondria membranes that are very delicate with those delicate phospholipids. Some of us might be familiar with them in terms like lecithin, but when you break down lecithin you get into these phospholipids where those lipids have like a affinity to, or they kind of are attracted to, the fat layer of the cell membrane and the water, the hydrophilic layer, and that gives its electrical kind of energy and power. And they're very delicate and they're difficult to get in food. Again, we want to be food as medicine. Where do we get these phospholipids? Well, many of us aren't really eating many of these foods because of the farming industry. For example, eggs and those yolks of the eggs really did contain, when the chickens were eating worms and insects, those are very high in those phospholipids. Some things like choline and inositol. But that's what really makes up these delicate phospholipid bilayers that really help our neurons to communicate. So that's one of the focuses in the future, is going to be the mitochondria. We're helping the mitochondria as we speak in our center, South Florida Integrative Health Center, by looking at metabolites of the mitochondria through actually urine testing, because we knew we wanted to help people at home where they maybe didn't want to come into a laboratory, at least not at this moment. So we were able to give them a kit where we could see these urinary markers of mitochondria function or dysfunction, for that matter. So we see where it needs to be supported. Sometimes it's activated B vitamins like riboflavin, which is going to be combined with a phosphate group, maybe make it more activated for the mitochondria. Same with thiamine, has different forms that are much more activated, which, by the way, the thiamine that's fortified in the foods is a very poorly absorbed thiamine and might actually compete with our more activated forms of thiamine. And so that's one of the main concerns with aging, is mitochondria. That's going to be a focus in the future, something we're concentrating even right now with organic acid testing with the mitochondria, and we're getting in there with the phospholipids, the proper combinations of these fats like DHA and EPA, and really being cautious about oxidation. We really want to control those reactive oxygen species. Well, without getting too complicated and really into the nitty-gritty of how we really work at South Florida Integrative Health Center, the main thing is how we help patients really add quality years to their life by getting to these underlying causes. And I've been focused in on that for a couple of decades, really, ever since my beginning in the my medical career as a dietitian, certified in nutrition, and myofascial therapist, neuromuscular therapist, as well as personal trainer, because movement is so much into it. Then into the acute care ICU nursing, and then of course into nurse practitioner. All the meantime, really digging deeper with the different certifications and different groupings of groups of people that were along the spectrum, meaning that the herbalists out there really had their different conferences versus the functional medicine specialists. They were quite diametrically opposed. Their conferences, even some were held at these beautiful upscale hotels. Other conferences where these herbalists, who were incredible healers, were held in the mountains or these deserts in certain states. Incredible conferences. I love to go to both so I could join these incredible herbal healers as well as these functional medicine practitioners. And now we've brought it all together, adding in acupuncture, because that adds in the aspect of Eastern philosophy of healing, which is tongue diagnosis, pulse diagnosis, and the idea of the elements around us, like water, air, fire, earth. And we are attracted to those. They do add affinity. They do add we do have an attraction to these elements. And when we nourish our body with these frequencies, because everything has a frequency, then we can thrive in a much higher level of health. So one of the next ways we're going to really look into the future is this whole combination of melatonin and cortisol, and insulin and cortisol combination and interactions with continuous glucose monitoring, 24 hours 7, with salivary testing of melatonin and cortisol. We've already been doing that. It's really been amazing how it can really help people with their circadian rhythms. Any of you have any questions about this, give us a call at South Florida Integrative Health Center, or just check out our website, www.sfihc.com. That stands for South Florida Integrative Health Center. So that's one of the next things I'm finding fascinating in the future of medicine is this idea of peptides. Now, peptides has been used in medicine for many, many years. In fact, in endocrinology, in diabetes, we use the GLP, they're called GLP-1 agonists, and now they came out with a by-mouth version. They used to only be injectable, and they actually increase a hormone called incretin. So they're actually supporting our system. It's a really incredible new world of medications, and that's the beauty of integrative medicine, being able to use medications that don't just block or inhibit, which is really the majority of medications and why there are so many side effects. But when you can get medications that actually help our body with like insulin resistance, which is what the biguanides do, or GLP-1 agonists, which are peptides. Now they finally came out with an oral peptide. So we've been supporting other uses of peptides like BPC 157 for healing of the gut, or just increase an ability to support better forms of healing. So that's another way, another really exciting thing in the future is peptides and the use of these little amino acid sequences as not blocking agents, or it's not really even like a vitamin. It's more like a hormone, like a messenger, just like vitamin D is a messenger. So what else are we looking forward to in the future? That's really already two amazing things, don't you think so, everyone? Well, if you think other people want to hear this, please share the message about South Florida Integrative Health Center. We're really making incredible changes because we're able to bring together medicine of today with endocrinologists, pulmonologists, because we're really getting into sleep medicine using at-home sleep studies. So we could really get into that obstructive sleep apnea. That's why people feel tired the next day. And we can do testing at home now to see if someone has obstructive sleep apnea. So we're really getting into sleep studies and sleep medicine with pulmonologists, endocrinologists, as well as this continuous glucose monitor, insulin, cortisol, melatonin. And working with the gut. The gut is really what's going to help us with serotonin. And the serotonin, of course, leads to melatonin. Thank you everyone for joining. I want to recognize and really be appreciative of all the people who support us here at South Florida Integrative Health Center. Of course, all of the patients who we've helped. We are forever thankful, and we spend every day, almost every waking moment, looking and learning to help our patients. And the future, which is really what we're doing, we always want to be on the cutting edge. We've been working with homocysteine for so many years. Of course, now that's considered on the cutting edge. Same with CRP, high sensitivity, fibrinogen, uric acid, ferritin, all these markers of important markers, biological markers, but they're markers of aging or inflammation. All right, everyone, please share the message of South Florida Integrative Health Center. Put the comments in, give me a wave, give me a like, and thank you very much. Appreciate everyone. Hope everyone's having a really healthy day and helping others out there. I see a bunch who are also in the alternative field, acupuncturists, other nurse practitioners, nurses, other yoga teachers. So I know you're each and every one of you doing your part of bringing holistic and healthy healing, helping people. Healers are it's a tough word to use. Many of us don't describe ourselves as that. That's one of the things I saw at the herbal conferences that I described earlier, that were held usually in the mountains or in the deserts, depending on where they were held in the United States. They didn't want to be called themselves. They didn't want to call themselves healers, but boy, were they really doing a lot of amazing healing. So those of you who are helping others, And those of you also on the front lines, we can't forget. I know I'm with you on many shifts out there when I'm doing my pulmonology and endocrinology, but you're really out there on the front lines. I'm there also, and it's all about just helping others, right? And making sure that we're able to bring a good, complete, true healing, which means incorporating that whole mind, body, spirit, and energy. So let's look forward to 2021. We got the mitochondria, we got the gut, and all the connections that the gut has with the brain, and inflammation and autoimmunity. We have these peptides, even in conventional medicine, using these GLP-1 agonists, which are incredible. It even helps with weight loss because it's supporting the body. And a lot with blood sugar is supporting the body. That's why medications in diabetes actually are just teaching us on how to eat. A carbose, some of the medications, one of them is called a carbose, actually slows down the digestion of carbohydrates, which is one of the ways those of us who do nutritional therapies, or we're helping people with food as medicine, we help them with certain fibers to slow down these carbohydrates by having these complex carbohydrate type foods rich in certain fibers like resistant fibers. But they have medications that are doing that same thing, and that helps us to understand these underlying processes that we can support through food and through natural modalities. So that's integrative medicine, the medicine of the future, but it's here today. If you have any questions, reach out to South Florida Integrative Health Center. I hope everyone out there learned and got something out of it. Thank you everyone for joining. Everyone have a healthy day.